Safety and efficacy is the most important thing in breast reduction surgery. We are very happy to say that our paper regarding triple lipodermal flap has been published in the Aesthetic Surgery Journal Open Forum. The most common problem that happens with breast reduction surgery is the skin death that is noted at the T-Junction area. To overcome this, we have included dermal flaps in specific areas that greatly reduces the tension and improves the outcomes.
We always feel that wherever the difficulty, wherever the complications are routinely coming, we need to find a solution for it. Not that we need to keep doing the same mistake again and again. So we found this technique is really useful. Once it was published, now 75 PDF downloads and 250 views are there. A lot of people across the globe calling and mailing us to get the more information about the technique. We are very happy that we are instrumental in bringing this technique and making it reach wider population so that all the patients are getting benefited by this technique.
In breast reduction surgery, we have included multiple techniques to improve the efficacy and reduce the patient's downtime.
Actually, the modifications were so much. So, starting with already we published the triple dermal pedicle flap method, that is to reduce the T-junction necrosis. Second, for the vertical pillar strength, we have started keeping a dermal element in the vertical pillar. The lateral pillar, we are keeping the dermal element. So that vertical pillar scars are much better than earlier. The third, whenever the patient comes to us, they always ask as small as possible. That time, we need to be very sure about the blood supply. So we started marking the perforators, where the blood vessel is coming. So we are using the Doppler to mark the perforator to reduce the incidence of the necrosis, the death of the areola. So it's very confidently we can thin the pedicle, so get a good result. The fourth one, infiltrating the tumescent and doing a liposuction before the surgery reduces the blood loss so much so that we can finish the surgery faster. Our surgery now we finished in 2.5 to 3 hours time. Earlier it was 3.5 to 4 hours time. That increases the recovery of the patient faster. Same way we have following suture. So now for the strength of the scar, we are using a bob absorbable sutures and non-absorbable sutures in the area so that the scar strength becomes much better and the final scar output is really good. And in the recovery phase, when we see the patient, though everything is good, but they feel tired all the time. So to come out of that phase faster, we are using the IV drip infusion, which has a lot of multivitamins, a lot of minerals, and a lot of healing elements in the drip, which make the patient recover faster and go back to the work faster. So these are the modifications we have done in the breast reduction surgeries so that patient recover faster.